everyone. Very good to see you, be here, and what an inspiring conversation we've had over the last couple of days. I want to talk a bit about a partnership called Everybody Walk. I don't need to talk about why, because the health benefits, economic benefits have been well discussed, but I want to say a bit about what the partnership is, how we've constructed it, and so what? What has it started to produce? To help you understand why we created a partnership, I want to begin by saying I work with a large U.S. health organization, and we're an insurance organization. And the interesting thing about that is we take the premium dollar, right, a fixed amount of money from government and individuals and companies, and we need to take care of all of our 10.5 million members for that. So we're 100% at risk for the health of our members, and at best, the healthcare sector controls 20% of what creates health. So we're at risk for 100% and control 20%, and if we don't create partnerships, our business model doesn't work. So partnerships are really at the heart of this. In the US, we spend 18% of our gross domestic product on medical care. 80% of that is driven by chronic disease. And the 4 modifiable risk factors, the 4 things that are upstream from that, are moving more, eating healthier, cutting the tobacco, and moderating the alcohol. And the gateway drug, the wonder drug in all of that is, of course, walking. So what's the dose? 30 minutes a day, moderate to vigorous physical activity, 60 minutes or more for kids. What are the side effects? Well, weight loss, improved mood, sleep, bowel health, looking and feeling better, and of course, all of these benefits, including cutting the risk of Alzheimer's by half. So the health benefits are extraordinary, and we know that we need to be making sure that we're helping people get more and more physical activity. Our CEO at the time said, we need to get people walking because it's literally the only way that we're going to get ahead of the chronic disease epidemic that is essentially breaking the bank of our economy and is making healthcare so expensive that it's almost unaffordable for most Americans. So really, walking is essentially upstream from this at the core level. We have 200,000 employees, and if we count the spouses and partners, we have 500,000 people who we're at risk just in the families of people who work with our organization, our largest group. So we started by getting more people walking at work. Our partner there is the 28 labor unions that actually make up represent about half of our workforce. And labor has been incentivized to improve the health of the workforce because there's a payout, not a payout to individuals who do a little bit better, but a collective payout when the entire workforce meets targets. So essentially, instead of doing an individual strategy, it became a collective strategy to improve the health. We have 12,000 schools in our footprint. So we partnered with the Safe Routes to School National Partnership, a national network, to make sure that every kid has the opportunity to walk or bike to school safely every day, and that the 60 minutes or more every day that a young person needs, according to the Surgeon General and World Health Organization, have you seen, that ideally they can get that to, from, or at school every day. So that's where our partnership began. With our members, 10.5 million members, we started asking them as a vital sign, height, weight, do you smoke? We started asking them, how many days do you get 30 minutes or more of moderate to vigorous physical activity? And then if they say, well, I try, or I get tired and I'm working too much, or I hurt my knee and all that kind of thing, we write them a walking prescription. Or we say, well, what do you like? Well, I like to dance, or we write them a biking prescription or a dancing prescription. And we have a conversation with them about what's their passion for physical activity. But walking essentially is the default. Then we partnered with the American College of Sports Medicine to make a walking prescription and increasing that so that it becomes a standard question, a vital sign that's asked and goes into the medical record at every single visit. But so we built this campaign, and public awareness campaign on the health benefits of walking. And we created a beautiful website, and next thing we know, 20,000, 30,000, 50,000, 100,000 people visiting it. We even produced a feature-length film. But what did we come across? We tried to build the demand for more walking is a inadequate supply of safe places to be active. So we know that we could boost demand, but that unless we had a supply of safe places to walk, we couldn't actually have the impact we want. But we're a health organization, so partnership is the only way, right? This is the American way. So what we did is that we took a couple of dozen of organizations that were interested in walking, but were all doing their own things. And we took the bicycle movement, which had in many ways well-funded by the bicycling industry, all about the bikes, and we said we need one combined voice. You can do your own thing, but one combined voice to actually spread this strategy. And about 6 years ago at the Pro Walk, Pro Bike, Pro Place conference in California, we actually formed what would become the Everybody Walk movement. 2 goals: more walking, more walkable places. Now, the strategy around this to actually build partnership, for us, of course, health. At the north there, health is the North Star for us as a health organization. But a lot of other organizations care about very, very different things. So our goal wasn't to get everybody committed to health. The goal was to have everybody look at what is in walking for you, to identify the co-benefit that was interesting to them as a partner. For some, like businesses, it was around cost containment. For mayors, city council members, economic development authorities, it was about economic vitality. Of course, they care about health, but economic vitality was their North Star. For national parks, this is our 100th year of our National Park Service. It was about getting people into parks, into nature. And so we had different missions, but aligned strategies. And that's how we built the beginning of this as a social movement. Again, the strategy: everyone's invited, work on multiple fronts, a clarity of purpose. We're all working towards the purposes that our members are interested in, and distributed action. So we started looking at what makes for a social movement. We looked at the environment movement, the women's movement, the civil rights movement, and we said, what are the elements of a social movement that if we were going to do that more than have a campaign, but we wanted to have a social movement that would create distributed action, what needs to be part of it? Now, our time's short, so I won't unpack all of this, but we got clear that we needed strong voice and leadership. So we found champions from many, many different groups, from the American Association of Retired Persons to the parent-teacher associations that are in all of our schools. Their focus: cognitive improvement, cognitive important for test scores for kids. So we essentially said the environment are interested in reducing carbon footprint, the health organizations in improving health. The equity organizations working on social justice, it was about mobility and access to jobs, access to school, and safe places to be in troubled and challenging neighborhoods. So we built a social movement, again, if you will, addressing leadership. Secondly, we made grants, large grants and small grants. We built a communication strategy so that we could start telegraphing common messages. We built technology applications and websites so that we could begin to reach through social media. We produced a combined event every couple years, a summit. We started to build out programs both in our organization and others, and we built partnerships. These 8 elements all being essentially what we found as the underpinning of a strong social movement. We built a partnership, the Everybody Walk Collaborative, with a backbone organization of the U.S.'s leading walking organization, America Walks. We built 600 national organizations, picked America Walks as the backbone, and then identified communications, shifting social policy, and making place-based investments as the centerpiece. We built a research agenda with the Centers for Disease Control and Prevention to begin to identify what the elements were that were needed to build the evidence base, and we started investing in the hundreds of local place-based organizations in hundreds of communities, most of which their annual budget was $5,000 or $6,000, and we started seeding in these small groups to help build the place-based movement. A strategic plan was put in place to actually help us make sure that every American was getting enough physical activity to have a health benefit, that every American community was demanding safe places to be active, that all 50 states had champions that were working with the state legislatures to actually change policies, And we built this national identity that lifted up each individual organization, but it essentially created a singular way that we worked together behind this. The U.S. Surgeon General then issued a call to action to promote walking and walkable communities. It took about 5 years to get that, but then last year, the Surgeon General's call to action came forward with a research agenda, and this put this on the national strategy in a very, very important way. And it allowed us to start convening our U.S. Department of Transportation and Housing and Human Development, Health and Human Services, and the Environmental Protection Agency, all of whom had strong co-benefits in the case for walking and walkability for different reasons, but for the very first time, they started talking with a shared agenda to help create a national agenda. We are now facing our third walking summit. We'll be just a week or so adjacent to Walk21 in Calgary next year. And our focus going forward are to continue to build out proof points for different sectors. Secondly, if we're increasing more people walking, we need to reduce bicycle and pedestrian injury and fatalities. So we're now spreading Vision Zero in dozens of communities across the country. We're trying to make a much more explicit connection between walking and nature so that we have the benefit of awe and wonder of being in nature, and also more around social connection and a sense of belonging by people being with each other. So it's not just about the physical health benefit, it's about the benefit of actually being in relationship with each other. And much of our focus now is around placemaking and the design of cities to actually drive the change. So I'm looking forward to a dialogue with my fellow panelists in a moment. Thank you.